If you are appearing for this year UPSC CMS 2025 exam, then you are at the right place. This is not a strategy video where I would tell you what to study and from where to study, then what I am here for. So hi everyone, myself Dr. DEEKSHA AGARWAL guided thousands of aspirants in these last 4 years, and now I am again back to help you all in this UPSC journey. So let's start without wasting any further time. So what are the big changes which you must know that is going to happen in this year exam? The first and the most important change is the salary. Till you get your joining letter, 8th pay commission is going to be applied and your starting salary is going to be huge. Somewhere between 1,40,000. After doing your MBBS, you apply for job in any private setup, you hardly get 40 to 50,000. Or you join non-PG JRship, it varies from 60,000 to 1 lakh in some places. So why not to choose this job? And it's just not about money bhai, it's a A-grade central government permanent job जिसमें हमेशा ही सैलरी बढ़नी है with job security. अब मैम सैलरी की बात तो हो गई, पर यह एग्जाम निकलना भी तो चाहिए. So for this you need to understand कि with time the competition is only going to raise, and आगे ये 75,000 न्यू मेडिकल सीट्स स्कीम लॉन्च हो गई, देन दिस एग्जाम इज गोइंग टू हैव अ नेक्स्ट लेवल फेम बिकॉज देन यू विल फेस द स्कैसिटी ऑफ जॉब्स इन इंडिया. सो इफ यू आर एन FMG ग्रेजुएट, MBBS ग्रेजुएट और अ नॉन क्लिनिकल ब्रांच पोस्ट ग्रेजुएट, देन यू शुड डेफिनेटली कंसिडर दिस ऑप्शन. अगर थोड़ा थोड़ा मूड बन गया है इस एग्जाम को देने का, तो कॉम्पिटिशन लेवल भी जान लो. In current scenario, it is easier to get in this exam as compared to NEET PG as the number of applicants are less. बट मैं ये नहीं कहूँगी कि बस फॉर्म फिल कर दो सिलेक्शन हो जाएगा, थोड़ी सी मेहनत तो करनी पड़ेगी. बिकॉज यू कैन सी ऑन स्क्रीन कि जस्ट बिकॉज ऑफ अवेयरनेस अबाउट दिस एग्जाम इन दिस फ्यू ईयर्स द कट ऑफ वेंट टू हाइएस्ट ऑफ ऑल, दैट इज 67%. So you can have an idea about the demand and craze for this exam in the upcoming years. This year is the golden period and the maximum chance to get your selection done because आगे competition tough ही होने वाला है. So for that, please note down these dates or keep a screenshot of this. Your application form filling would start from 19 February till 11 March. Please don't miss to fill this form because in these last 4 years I got multiple messages from students. मैम एग्जाम फॉर्म फिलिंग डेट निकल गई, अब कुछ हो सकता है कि तो कुछ नहीं हो सकता उसके बाद जब ये एग्जाम डेट निकल जाएगी तो. And for next important date is 20th July. This is the day when you will appear for this exam. Now the next question that will appear in your mind कि इसकी cost कितनी होगी? But my dear friends, it's a pocket friendly exam. You just have to pay a fee of 200 rupees for this exam. And उसमें भी it's free for SC candidates, ST candidates, female and PWBD candidates. Ma'am, my preference is NEET PG. Why to get distracted for this? So please note your NEET PG exam date is 50th June. Not at all clashing with this exam. Don't prepare for this UPSC CMS exam from today. Do your best in NEET PG with your current strategic preparation. And after it gets over, आप UPSC CMS targeted हो जाओ. That 35 days difference is more than enough to crack this exam. बस आपको last 6 years papers ही तो लगाने हैं और कुछ subjects revise करने हैं. अब आप कहोगे मैम why last 6 years not 10 years? Because my dear friends, you can see on the screen कि UPSC government has revised its syllabus and the pattern for this exam in the year 2018 has changed. So that's why if you practice MCQs or any guide you follow the questions of 2017 or before, then it's a waste. Because previously there were some general knowledge questions and some other subjects were also included. Now they are been excluded from this. You just have to do only this much of subjects. The current pattern, you just have to prepare these 5 subjects with the weightage mentioned. This exam happens on same day in the 2 shifts. एक सुबह होगा 9:30 to 11:30 where you would be asked about general medicine and pediatrics, and the weightage of subjects is also divided. NEET PG या एम्स की तरह नहीं कि कभी पैथो ज़्यादा पूछ ली तो कभी PSM. And second paper होगा lunch time में between 2 to 4 and you would be asked about surgery, gynae, PSM, 40 questions each. But ma'am, मैं तो अभी final year में हूँ, can I give this exam? Then yes, you can. But the only condition applied is to have your pass your final year exams as soon as the written exam of this UPSC results declare before filling the DEF form. The last date of DEF filling form is the final date where you should be having your final year subject result. That means if you are an internship candidate or if you have passed your FMGE and you don't have your internship certificate in your hand, then yes, you can apply for this exam and the UPSC government has to wait till your internship gets over. Your selection doesn't get cancelled. If you have cleared your written examination and also cleared your interview, then definitely you are selected. No matter your internship gets over within a year or within a 6 months, they will keep your job reserved. Once you get your internship completion certificate in your hand, you can get your joining letter for that. So If you are a final year, if you are FMG graduate, if you are intern, if you are post intern, anybody can appear for this exam. So don't worry about your eligibility. So I hope you get an overview of this UPSC CMS exam, as the exam is around the corner. So my suggestion from my side is just jot down the date when you have to fill the form and keep preparing for your NEET PG. Once the NEET PG gets over, please do not miss to appear for this exam and just revise those 5 subjects and practice MCQs only of the last 7 years. So all the best, keep preparing. If you have any doubts, you can comment below in this video. I'll definitely try to solve them all. Hope you find this video. So do subscribe if you like this. Thank you.